Hi, this is Dr. Jeanette with DeWitt Physical Therapy and Wellness, and I'm here to talk to you today about exercise. Do you know that there are thousands of exercises out there? I'm sure you've seen them in the fitness magazines, on the internet, in other people's blogs, things like that. But not every exercise is right for everyone. In fact, there's a lot of people at the gyms that are in your community that are flat out doing the exercises wrong. Now, some exercises just might not be the right one for people, but sometimes you pick the right exercise for you, you're just not doing it correctly. Or you're doing everything right, but you're not giving yourself a chance to take a break. And that's a lot of what I see when I have people walk into my clinic. Now, if somebody comes in with pain, we start at a different point than if somebody's exercising and they want a program to get to their optimal health. If somebody comes into me with pain, then we go through the physical therapy rehabilitation process. The first phase of that is to get the pain gone. Physical therapists are in the pain relieving business, so that's the first thing that we would address. And we would figure out what the root cause of the pain is so that it doesn't come back. The second phase of the rehabilitation process is getting their movement back. That means, are their joints moving the way they should be? Are they flexible in their muscles? Do they have the range of motion that they need? Then the third phase is getting back their strength. It's one thing to have the motion and it's one thing to have the pain gone, but if you're weak and you still can't do what you want to be able to do, then we have to get you stronger. And the fourth and final phase of physical therapy, rehabilitation, is to get you back doing what you want to be doing. And as a person goes through that process, reducing pain, restoring motion, getting stronger, and then getting back to doing the activities that they love, whether it's sports, whether it's returning to work, or whether it's just being able to be active with your family. These are all things that would be addressed through a physical therapy rehabilitation program. But what about the next step? Or what if you don't have pain? Then you can bypass that physical therapy rehabilitation program and go into a physical therapy preventative program. This prevention program, or this sport performance program, or this get you back to doing what you want to be able to do without worrying type of program, also goes through 4 phases. The first phase is, if you're an athlete, is more of a pre-season phase. And this phase is where you're getting ready, you're getting your body ready to move in the way that you want to compete in. For somebody who's an avid exerciser and not really a competitive athlete, this would be getting you ready and getting that baseline of activity ready so that you can start to progress and get your general fitness up. Now, the second phase is going to be your in-season program. And your in-season program is where you do a little bit less strengthening because it's really hard to build strength in the midst of a competitive season. But you maintain. So the goal of a in-season program is going to be maintain your strength level, maintain your flexibility program, and try and reach your peak towards the end of that competitive season or towards your event. So if you're a basketball player, in the beginning of the season, you're going to be doing more strength training, you're going to be maintaining your flexibility. But as the season goes on, the goal might be just to do some strength training 1 to 3 times a week because you're going to be competing and playing a lot more games. So for the non-competitive athlete who wants to maintain their fitness or is trying to maybe focus on a single event like a marathon, about a month before that event, we would taper back their strengthening and try and maintain that strength through once a week strengthening, or maintain their flexibility and then try and reduce some of that running mileage as they're preparing to run for that big event. For a non-competitive athlete who is focusing more on general fitness, this phase is just, again, building. So you've passed that baseline, and now you're going to try and increase your resistance or increase your intensity or increase the duration of time that you're exercising. The third phase is going to be your post-season. And this is a recovery time. This is where you take a little bit of time off from that sport you were trying to compete in. And you might still play. So you might still play basketball or you might still run after that marathon. But you're really tapering back that activity, letting your body have a rest time, focusing more on flexibility, not so much strengthening, but resuming a little bit more core stability, and just letting your body heal and take a mental break as well as a physical break. It doesn't mean you're inactive. It just means that you're not going as intense as you were in that competitive season or in-season time. For the non-athlete in this phase 3, this is where you're giving yourself a break too. You're focusing on something different. Maybe you're trying a new activity, or you're just trying to relax, or maybe this is the time that you're on vacation and your activity is different from your typical get home from work, exercise at the gym. This might be when you're on vacation at the beach and you decide to walk in the sand, you decide to play a little beach volleyball, you swim in the ocean, or if it's wintertime, you might do a long distance skiing or snowshoeing or something like that that is different from your normal activity. And the final fourth season is the off season. And this season is really where you want to build strength. This is the focus of the off season. You've recovered now from your recovery phase. You want to start tweaking your technique, really working on form and how you can improve that form. So when you go back into your preseason or your in-season, you have this muscle memory that is going to take you to the next level. So the off season is the time where you're really focusing on strength. You might even do strength training 3 to 5 times a week, mixing that strengthening up with weights, body weight exercises, resistance band exercises, maybe some speed work, and just power type of workouts. For the non-competitive athlete and the avid fitness exerciser, this off-season time is a time where you decide for 8 weeks, maybe even 12 or 16 weeks, so 3 to 4 months, you're just going to hit the gym really hard and work on getting a solid strength base. You're increasing your core stability, you're increasing your plyometrics or your jumping, you're just trying new things like circuit training and jump training, or you're trying to figure out a way that you can take your performance to the next level. And maybe you're even considering at this point, hey, I might try a 5K, or I might try a marathon, or I might try and get in that new soccer league or that basketball league that my friends are in or my coworkers want to participate in. So it's another time where you're going to kind of reflect back and just see where you want your fitness to go. So you can see there's lots of different phases, and depending on what phase you're in, depends on what your focus is on. And one of the roles that I play when people are looking at beginning a fitness program, if they're looking to lose weight, if they're looking to take their performance to the next level, is creating a calendar where we can create these phases on the calendar and say, we're going to be in this phase for this many weeks, then we're going to go to the next phase for this many weeks, and so forth, until we kind of create a year-long program. That works really well for athletes, to set that designated schedule up so they know exactly what they have to look forward to, whether it's competition or whether they're getting a little burned out when they're in their in-season and their competition phase, and they're really looking forward to that recovery phase. It's nice to have that schedule blocked out. For the beginning exerciser, it's less programmed than that, because we have to just reassess every 6 to 8 weeks or so at a minimum. Ideally, it'd be once a month to see what their fitness level is, because as you start to progress with your flexibility, as you start to progress with your strength, then we want to challenge the body a little bit more. Your muscles have memory, so because they have memory, they're going to get bored and you're going to go on remote control. And if you're trying to lose weight or trying to build strength because you just want to be able to have better endurance to be active, then you have to test your body a little bit instead of just always staying at a plateaued level. And usually we like to tweak things every 3 to 4 weeks. And at the very minimum, 6 to 8 weeks, we change things up. So the phases for a non-athlete are a little bit different. They're a little more flexible because you don't have events scheduled throughout the year. You're trying to maintain optimal health. And all of that can be scheduled out on a more flexible basis than with an athlete. Either way, whether you're an athlete or a non-athlete or just an athlete in your own head and looking to go into more fitness, it's really appropriate to have an exercise plan. It doesn't have to be as structured as you might think, but it can be as structured or as flexible as you want it. It just has to be something that you're increasing your cardio, you're increasing your strength, you're improving your flexibility in a safe and effective way. And these are the types of programs that I create for my patients, and as they progress from being a patient to more of a fitness client, I take them through safely and effectively so that they don't injure themselves or hurt themselves along the way. These can be individualized programs that are unique specifically for each person. And they're really helpful in reducing injuries. They're also available to give you more confidence and help you to know that the exercises that you're doing, you're doing them correctly. Some common mistakes that people make in the gym or with their workouts is they go and they change too many variables. So they'll change their intensity and they'll change the duration of their activity all on the same day. So now they're trying to run faster for a longer period of time and their body can't really keep up with that. I like to prevent those type of things from happening by changing one variable at a time. Because if you change two variables like speed and intensity and you're sore the next day, you really don't know which thing caused it. Was it because you went too intense? Or was it because you went too fast? So we like to keep variables minimized and change one thing at a time so we can kind of track how you're adapting to that. Another thing that I see is that people are doing exercises just flat out with wrong form. For example, the push-up position is a very common exercise where people really don't do that exercise correctly. And I help to teach them how to do the push-up correctly so that they're not hurting their shoulders, hurting their back, or hurting their neck. Another common exercise, or actually two common exercises that are misused or not used correctly, are the abdominal machine and the back extension machine. So that's that machine at the gym where you're sitting and you're doing this, and it's that back machine that you're pushing back. A lot of people do these type of machines incorrectly, and a question can actually be raised, should they be even done at all? For example, you always are told, don't bend at your waist to lift, and don't sit and lift a heavy box. But when you're sitting in that abdominal machine and you're flexing forward and pushing weight, there's really nothing in your day where you would ever do that. And so I see a lot of back strains happening from that machine. The same thing with pushing back on that trunk extension machine. That's another exercise you have to question, is that something that I would ever do or should be doing? For example, you would never push back against a heavy load if you were sitting down. That's a lot of force on the spine and on the discs in your spine. So the question could be raised, are these two exercises appropriate really for anyone? So just to summarize here a little bit, some of the exercises that people are doing, they're doing flat out wrong. The other thing that they could be doing is changing too many variables at one time. When you do this, you really don't know which thing caused pain or which thing caused an injury. So I encourage you to just check out what you're doing and consult with somebody who is an expert and is a specialist in exercise prescription. A physical therapist like myself is a perfect person to just even bounce ideas off of, get a consultation or an evaluation to see what your strength baseline measurements are, to see what your flexibility actually is, and to learn which exercises are actually the correct ones for you. Just getting that baseline idea of where you should be and where you want to be are really helpful. So I challenge you to consider, if you get an annual physical with your physician, to learn about your blood work, to learn about your general health, I challenge you to consider getting an annual musculoskeletal evaluation from a physical therapist. They can help you learn your body weight, they can help you learn what your body mass index is, they can help you learn how to stretch and how to get your flexibility back, how to restore your range of motion, and how to increase your strength safely. They can prescribe exercises that are specific to you and teach you how to do them correctly so that you're not setting yourself up to fail with an injury because you're not doing things the way you should be. I hope this has been helpful for you, and I would love to have a conversation with you. Please feel free to check out my website at www.dewittptwellness.com or just shoot me an email at jeanette@dewittptwellness.com. I look forward to having a conversation with you soon. Thanks a lot and have a great day.